I spoke to Dr. Fauci about this week, and you've written about this in recent days. You've reported about how the president has railed against the so-called medical deep state, his term. So while I spoke to Dr. Fauci and you're talking to him and other officials, who is actually in charge right now inside the federal response?
I think the problem is that no one is really in charge inside the federal response. You know, the White House has really not paid a lot of attention to the coronavirus response for weeks now preceding the election. We've spoken with several officials, both political and health officials, who said the White House coronavirus task force meetings at this point are little more than political theater. So, you have the agencies that have very clear work to do, the FDA on reviewing and authorizing these vaccines, distributing personal protective equipment, preparing for vaccine distribution. But when you're talking about, the entire federal response that really should be led out of the White House, there isn't really a leader there. And I think you can see that in the conflicting messages you get from people. You have people like Dr. Fauci, really sounding the alarm for these last several weeks about the direction we're headed in. You have the president, sort of barely acknowledging the rising infection and death toll. And then, all manner of officials in between. You've got the Secretary of Health and Human Services, Alex Azar, reiterating basic public health tenets, talking about their vaccine progress. But, you're not seeing a coordinated, centralized federal response. And I think that's reflected in, the messages you see depending on who's giving it that day.
Sarah, I want to come back to your beat for a moment. In terms of testing and treatment, what are the costs of this pandemic?
So for patients, they are supposed to be free. There are some rules that Congress passed this spring that are meant to make coronavirus testing free, and with good reason. We don't want people to be afraid of a medical bill and not get tested when they think they might have coronavirus. So that means no co-payments, no deductibles, a special fund to cover tests for those who are uninsured. Unfortunately, what I've been finding in my reporting is that many patients are facing costs, and sometimes quite significant costs, for their coronavirus test. In rare cases, over $1,000 for a test that they expected to be free. And I think this really reflects the way that our healthcare system works. And again, the fragmentation. I've talked to insurance companies that have tried to implement these rules, but the coding is quite complex. Sometimes providers will tack on extra services patients weren't aware were being added, and they'll get billed for those things beyond their coronavirus test. So right now we're having millions of coronavirus tests every single month. And unfortunately, you are seeing some patients get medical bills. I think the other side of this to be aware of is that you have patients who are uninsured or patients who have gotten a surprise medical bill in the past, and they might be a little bit nervous to get a coronavirus test because they don't think they can afford it. I've talked to some people who faced steep costs for flu tests, for example, and now are nervous to get a coronavirus test. So it's a unique element of the pandemic in the United States that you have this medical billing side that is going to be an element that makes it harder to control the pandemic here versus in other countries.
Those are challenges for President Trump, but also for President-elect Biden, who is putting together a strategy. However, for weeks, the president refused to sign off on the transition. Finally, on Monday, the head of the General Services Administration informed Biden that he could begin the process. Yasmeen, what's your assessment of Biden and how he will handle the pandemic?
I think he made pretty clear as soon as he was declared the winner of the election. You saw him 2 days later announce his coronavirus task force, transition task force, which was made up entirely of doctors and health experts. So, I think he tried to signal right out of the gate that this was going to be a science-led response. He was going to follow the advice of scientists. You saw him appoint Ron Klain, his chief of staff, who was the Ebola czar for the Obama administration in 2014 and was generally praised for the way he coordinated across the federal government to manage the Ebola response. So I think, you see that this is going to be the top priority for the Biden administration when they come in front and center. The Biden team has also signaled that they're going to put the CDC front and center, including career officials who were cast aside in the Trump administration for, straying from the message that the Trump administration wanted to convey. So I think he's trying to signal in every way that he can that this is going to be a much more muscular federal response. They're going to try to help the states as they can. The big thing to keep in mind is that they're going to inherit an enormous crisis. Cases are already at almost 200,000 a day. It's hard to predict where they'll be by the time they take over. So it is going to be an enormous challenge that they're going to inherit.
Fareed, what would you add here about President-elect Biden?
I think Biden has exactly the right instincts. He has very good people around him. But I think that one of the things that we have to understand is that the United States really failed at every level. It's not just President Trump. Trump, you can blame him for a lot of things, and I think he deserves that blame. But it's been a broader systemic failure. One of the things I talk about in my book is if you look around the world, you see that the countries that did well were countries that had figured out how to get government right and how to get government right in a response to a crisis like this. So, for example, Taiwan, which really gets the gold medal for this, figured out how to do not just testing, but also tracing and then isolation of the people. You see, the most important thing is to get the infected and the potentially infected out of circulation. So I would hope that what the Biden administration can do is learn from Taiwan, South Korea, by the way, all places that had no lockdowns. The vice president of Taiwan who ran this told me a lockdown is a sign you have already failed. What you have to do is figure out how do you take the infected, quarantine them, isolate the potentially infected. That's usually, he said, in his case, in Taiwan's case, it was 1% of the population. That allowed the other 99% of the population to live life as normal. And if we were to isolate these people, give them hotel rooms, give them, 5-star service, the cost would be a fraction of what this country is losing economically as a result of the coronavirus. So anything you can spend to have an intelligent and aggressive response would be the right answer. One of the things we're bad at in America is learning from other countries. We think we're exceptional, and we are in certain ways, but it blinds us to the reality that there are some things we do very badly, other countries do well, and it would do to have a little bit of humility and look around at best practices.
Sarah, Congress is deeply divided here in the States. Are you expecting more executive actions next year on issues like testing rather than legislation?
I think I am, but there's only so far that executive action can get you. You can get a lot farther if you're able to move legislation through Congress. And I think you see this, for example, with the issue of masks. Joe Biden has spoken positively of a mask mandate, but it does not appear that there is federal authority to create something like that. I do expect more executive action around a testing strategy. Joe Biden has outlined a pretty comprehensive plan for how he wants to increase to about 100 million tests a month. That'd be a big jump from about the 30 or so million that we're at right now. But a lot of it's going to be easier to do if you can get the buy-in of Congress to fund those sorts of things, and also to get the buy-in of the American people. I think one of the things you're seeing right now is Americans are taking a lot of their cues from their political leaders. And if you have President Trump, mocking masks or, not talking about the importance of getting tested, even if the capacity was there, you might see some of his supporters not wanting to use those resources. So I think part of it is getting Congress and getting the buy-in of congressional Republicans would signal to the American public that both parties feel like this is important and this is the right thing to be doing.
Yasmeen, quickly, what's one thing you're watching as a reporter in the weeks ahead?
I think the big thing is whether we see a big spike after Thanksgiving and how states try to manage that. We saw a big spike after Memorial Day when people felt it was safe to get together. And at that point, cases were at about 20 or 30,000 a day. So I think that's the big thing. And then, of course, how the federal response changes or doesn't change in the coming weeks.
And Fareed, in just a few seconds, what are you watching?
The Georgia races, because everything depends on whether Biden will be able to spend money or not. At the end of the day, as others are saying, it all becomes much weaker unless you can spend a lot of money fast.